we're going to do the head to toe physical assessment, and you see what I'm using here. I'm using the exact same form that you guys are going to use. The first part here is a history. I would have already gotten history on him. All of this would be filled out. Okay, so we're just going to start out with inspecting the face. And, you know, as looking at his face, I see that everything is symmetrical. Everything symmetrical. I don't see any blemishes, anything like that. And next, sort of palpating the scalp and inspecting the scalp. And let me know if you feel pain or anything at any time. I don't feel any nodules. Hair is evenly distributed. Face for expression and symmetry, again, we've done that. Temporal arteries, we can feel both of those. And I do feel them both. They seem equal. They're symmetrical together. Next, I'll palpate the TMJ joints. So what we'll do is put here and just open and close your mouth. Okay. Any pain with that? Okay, and I don't feel any clicks or anything that would be going on there. Next, we'll evaluate cranial nerve 5. I'm just going to ask you to do several things. If you will just sort of do what I ask, can you clench your teeth real tight? Okay, and then hold against resistance. Okay, and he does that real well. Cotton wisp, which I forgot to bring down. Just close your eyes and tell me when you feel this. Okay, very good. So that was cranial nerve 5. Next we'll do cranial nerve 7. So if you will just do a real big smile. Okay, frown. Okay, that's a hard one to do. Okay, close your eyes tightly. Okay, lift your eyebrows, puff out your cheeks, and show your teeth. Okay, very good. Okay, so that's cranial nerve 7, so we're going to move on to the eye. The next thing we're going to do is, the first thing is going to be the Snellen chart, just visual acuity. So if you'll step down, please. And guys, for this Snellen chart, you can get these, just go online, go to Google and Google Snellen chart, and you'll get all kinds of these that you can put off. Don't buy that. They're different. The one that I've got here is for 10 feet. Some of them you do it at 20 feet. It will just tell you. I measured 10 feet is about right in here. So if you will just, I need to turn the light on. Can you see okay? Do you have corrected lenses? And they're in. Okay, so if they wear glasses, they need to do this wearing the glasses because we're testing the vision with the glasses. Now we're at an eye doctor or somewhere where they're seeing what kind of glasses they need. They may have the glasses off. But for our purposes, we're going to do that. You can do this a couple ways. You can have them start at the top and go down, or you can just tell them to read the lowest one down that they can. That's usually the route that I go. So if you will, just read the lowest line that you see.
I'll read now.
Oh, and close one eye.
Lefodfct.
Okay, and then with the other line, or the other eye.
Lefodfct.
Perfect. Okay, so and that's the bottom line. That's 20/20 from 10 feet away. Right. Thank you. Can you just come back? Okay, so we now are going to test the pupils for size, first of all, extraocular movements. So with extraocular movements, we're doing the 6 fields of cardinal gaze. So what we will do is, I just want you to look at my finger and follow. Don't turn your head, just follow it with your eyes. So there, there, there. Okay, and what we're looking for there is that both of his eyes stay conjugate and both of them follow, which they did. Okay, now we will check his pupils for size, regularity, and I'll also look at his external eye structures, eyelids, and all of that. Okay, his pupils look to be about 4. They are reactive. They are conjugately reactive. His irises are blue. Sclera is white. I don't see any drainage. He's got good hair growth on his lashes and brows. Okay, for the ear, we first of all just, as always, we'll start out with inspection. Just look at the external ear. I don't see any drainage, anything, any pain. No? Okay, and then now notice we're not doing an internal ear on this, so you don't have to have anything like that. Next thing we're going to do is called the whisper test, where we will occlude one side and whisper something and ask them to, repeat what we said.
Football.
Okay.
Baseball.
Okay, very good.
How far away should you stand when you're doing the whisper test?
You
Just
just,
arm's length?
yeah, arm length. Oh, put my shirt. No, you're good. So now we go to the nose. Again, we start with inspection. Just looking is, it's symmetrical. I don't see any nodules, lesions, no drainage or anything. If you could just occlude one side and sniff, okay, and another. Thank you. A little cruddy. That's okay. So now we're going to go to the sinuses. We're going to do the frontal and the maxillary. And again, just let me know if you feel any pain or pressure. No? Okay, very good. All right, so moving on to the mouth and throat. Again, if you could just open up, please. Okay, so I'm looking at his tongue, his hard palate, soft palate. Teeth all seem to be intact. Everything is moist and pink. I don't see any abnormal drainage. So, okay, open up one more time. Okay, stick your tongue straight out. And again, against resistance, just sort of provide. Okay, and okay. Okay. So I sort of did gag reflex. I noticed that his uvula did, when he said it does rise symmetrically. Okay, so now we will go to the neck. And the lymph nodes. So what we're feeling here is the lymph nodes you may or may not be able to feel. If there's infection, you may feel them. Otherwise, you may not feel them. If you do, they should be somewhat spongy and movable, should not be hard and immovable. So we're going to start out, first of all, with the preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, and supraclavicular. Okay, any pain or anything? Okay, and again, I did not feel, there were no hard nodules or anything like that. And notice also how I'm talking my way through while I'm doing it. Obviously, when when somebody does this with you, they're not talking their way through that. You don't do that on patients, but we need you to do this on yours. Because if not, when you're looking in the mouth, all we see is you looking in the mouth. Okay, so make sure you tell us what we're doing, walk your way through this. Okay? Okay, where did I get to? Okay, so now we're going to do some, this is cranial nerve 11. We're going to do range of motion of the head and neck. So first of all, if you could just touch your chin to chest. Okay, and then turn head side to side. Okay, touch the ear, your ear to shoulder. And then both sides. Very good. And then extend your head backwards. Okay, and then just shrug your shoulders. Shrug up. There you go. Against resistance. And that was symmetrical. Okay, so for the thyroid and trachea, first of all, we note that the trachea is midline. There's no protrusions or anything, and it's symmetrical. For palpating the thyroid, you can do it one of two ways. Some will do the anterior approach from the front, and then most will do a posterior approach. Okay, one thing that would be nice for that I forgot to bring, again, is some water. You're going to have to ask the patient to swallow. It'd be good to give them some water to help with the swallowing. So what we do is just get behind. Oh, okay, yeah, that'd be great. That's yours. Yeah, that'll be good, thank you. The first thing you're going to feel will be the Adam's apple. From right down below that, you'll feel the first ring of the trachea, and then sort of come to the side there, and you're going to feel the thyroid. It should be relatively spongy, not hard, and it should move. You can push it over to the left or to the right. It should move fairly freely, and when he swallows, you should feel it move again symmetrically and freely. Okay, if you'll just take a drink of water. Very good, and I felt that nicely. Thank you. pulses, one side at a time. So. Okay, those are a regular rhythm, they're not bounding. And then we will check for carotid bruits. And again, a bruit would be a swishing sound. You should not hear that. A bruise are an abnormal. So hearing the swishing sound would say that there was some type of blockage or narrowing of the carotid arteries and would require, further investigation for that. And what side do you listen to that with? The bell, the small side. Now, if you guys have got some of the fancier stethoscopes, they don't have a bell and diaphragm, it's built in. Okay, when you do that, if you're using that, just make that statement. My stethoscope has a combination, so it has a bell and a diaphragm built in. Sort of hold it up just a second. Any more? Okay, and I did not hear anything. I got to the wrong side, didn't I?
That's okay.
So that's what we would expect. We would not like to hear anything there. Okay, so now we're going to do the chest, the posterior and lateral chest. So we're going to do the back here. If you've got, in a situation like me, if you've got somebody that's doing their camera and they want to move the camera around on the other side, that's great. But no, but if you've got it on a tripod or whatever, make sure you turn the patient so you can see. Okay, so again, we need to actually be able to see you do what you're doing. Okay, do you mind taking your shirt off? And then, yeah, just sit on the other side then so we can see. Okay, so again, first things first, we're just, looking at symmetry, which everything appears symmetrical. I don't see any nodules or anything that would cause me concern. And palpating, again, I don't feel anything. Everything looks and feels good. No pain or anything. Okay, then we're going to palpate for tactile fremitus, and what this is doing is basically just sort of feeling for areas of consolidation, congestion, that type of thing. You do it with the palm of your hands and ask the patient to say 99, and you feel the vibration, and the vibration should be symmetrical, so you shouldn't feel it more on one side or not on the other, or absent on one side, because that can be a cause for, again, areas of congestion, consolidation. Okay, just 99.
99. 99.
Good turn the table.
99.
Okay, very good, and just work your way down doing that, and again, just you should feel the vibration symmetrically on each side, which I did. Okay, now we're going to percuss over all of the lung fills. Books will show you percussing with your fingers like that. You're not going to get a lot of sound out of that. If you can use your little reflex hammer. And I've had some questions about reflex hammers. If you live here locally, we'll let you borrow them. I know the education department at the hospital has got them. Places have them. Don't spend a lot of money on this. Amazon has one for $3.97 with free shipping. So don't spend a lot of money. And what we're looking for here is just that the sounds are, again, symmetrical. What we're doing on the chest here is symmetry. Are each side's the same. Okay, and they were, so that's good. And now we will do breath sounds. And notice we're only going to do breath sounds on the back just for time here, and that's the same with you guys. And they were symmetrical all the way down and clear. Okay, now you can come back over on this side. Oh, I did not do the flank pain. Okay, we'll percuss the costal vertebral angle for flank pain. And again, the other percussing, we were listening to sounds. With this, we're looking for flank tenderness, which would indicate possible kidney issues or whatever. And with that, you're just gonna use, you know, the side of your fist lightly, and just, you know, let me know if you feel any abnormal pain. Okay, very good, thank you. I can come back over.
Do you have a question?
Yes,
Video, does our patient, are we required to make our patient take off their shirt?
I'm sorry?
Are we required to make our patient take off?
Oh, okay, yeah, that's a real good question, I'm glad you asked that. For female patients, first of all, okay, again, we need to see what you're doing. Notice, we're not gonna do anything, when I do this front of the chest here, we need to be able to see from, say, here up, and from, say, there down, okay? So you can do a tank top, because, you know, that sort of you can pull that down to about there, not gonna expose any breast, and then you can raise it up, and the same thing in the back. The best thing for a female, if they're comfortable, is like a full coverage sports bra. They give full coverage. I mean, they're more coverage than, they're full coverage. You're not exposed to anything, and you've got good access to it. And if the guys are not comfortable taking their shirt off, the same thing, tank top, but I do need to see, don't tell us that you're examining the skin of the back looking through a t-shirt, okay? But no, you should not have to expose anybody. Okay, with upper extremities, first of all, again, the same as always, we start out with just inspection, palpation, everything looks symmetrical, I see no lesions, anything like that. We're gonna do the radial, ulnar, and brachial pulses, and you can do those together. Radial. And then the ulnar. And all those are palpable, regular, and symmetrical on both sides. Okay, so cap refill. Brisk, definitely less than 2 seconds. Okay, so now we're going to go into range of motion. So first of all, with the shoulders, so if you can extend or flex your arms above your head. Okay, and then back behind. Okay, and then abduct and adduct. Okay. Now then, with the elbows, if you can flex, okay, and then do that against resistance, down, very good, and then pronate and supinate your forearms, so, okay, very good. Now with the wrist, if you can do flex and arm, yeah, there you go, make a fist, okay, and then spread your fingers and close them. Okay, and then touch thumb to each finger. Very good. Okay, and then cerebellar function, we'll do the finger to nose test. So if you will just stick your arm straight out, and then one side to nose, next side, and then sort of speed up a little bit. Very good. Okay, and now we will do graphesthesia and sterognosis. And that is basically where you're looking at sensory function. And if you will, with first of all the graphesthesia, that's where you have them close their eyes, have their palms open, and you draw a number, symbol, whatever, and ask if they can, you know, describe what that is. So just close your eyes, and I'm going to draw a number.
Seven.
Very good.
3.
Very good. Okay. And then sterognosis is where they can just, if they can tell you what a common object is by feel. So if you'll just close your eyes.
Quarter.
Okay.
King.
Okay. That's good. And then the reflexes of each arm. And we'll do those bilaterally just for time today. I'm going to do it on one side because we can do it on one. We can do it on both. These are a little bit confusing at times. The videos that I have posted in Canvas go into great detail about them, or you can simply go on YouTube and YouTube these, and you'll get, you know, like 45-second long videos that show you exactly how to do that. So first of all, we're going to do the triceps. So we will have here, and the important thing here is to get your patient to hang this arm loosely. So let it go just completely as limp as possible. And then the triceps tendon is right behind the elbow. And when you hit it, you should see the tricep flex a bit. It's not gonna be something that's just, unless they have some type of overactive one, but it's not gonna be something that's really noticeable, but you should see it flex a small amount. And it does, okay? And then the biceps, again, the biceps one is right behind the crook of the arm there. And again, just hang completely loose. Okay, and you do see the bicep slightly contract. And then after that, we'll do the brachial. And again, that runs right up along the radial side of the wrist. And what you should see with that is a little bit of thumb twitch. Okay, very good. It's always funny on these, and you can tell they've been practicing a lot, and you get this real thing. So anyway, you see that a lot. Okay, so now with the chest, the anterior chest, we're not going to listen to breath sounds here because we've already done that. So this is going to primarily be heart sounds. If you could just lay back here, make sure the table stays. Okay, so first things first, again, just inspecting the chest. You know, everything looks symmetrical. I don't notice any you know, pulsations or anything like that. And palpating it, you know, trying to get over the PMI. I don't feel that. I don't feel any vibrations or thrills, heaves, that type of thing. His work of breathing looks normal. It's not labored at all. And now we're going to listen to the heart valve. And we're going to listen two ways. We're going to do one. Oh, yes, ma'am.
I have a question. Is it better when you're shaking the chest, like, for them to lay down or sit up?
Lay down is best. And guys, for this, I mean, if you're doing this at home, you can use a sofa, a bed. I've seen very good ones on tables. You can use that. You can do that wherever. Okay. Okay, so let's look at where we're going. Okay, so we're going to listen to aortic, pulmonic, mitral, and tricuspid areas. We're going to listen for heart sounds, S1 and S2, or any extra sounds that might be there. And then we're also going to listen for any adventitious sounds, murmurs, anything like that. So let's look at where that is. Okay, very good. So we'll start out with the aortic, and that is on the right side at the second or third right intercostal space. So we'll start there. Okay, I do hear S1 and S2. We will go over to the left intercostal sternal space at about second or third for the pulmonic. Tricuspid just down from that. And then mitral. And for that, I was listening with the diaphragm. Okay, so now we're going to do the exact same thing with the bell. And again, the bell is listening for murmurs. And I hear none of that, just a clear S1 and S2. Okay, so now we'll move on down to the abdomen. And the abdomen is one where we've got to do it in proper sequence. So what would that sequence be? Inspect, auscultate, percuss, and then palpate. So first of all, starting with inspection, I see a flat abdomen. The umbilicus is inverted, so I see no signs of hernia. I don't see any pulsations or anything like that. Okay, so auscultating the bowel sounds, that again will be with the diaphragm. We're going to listen in all four quadrants. And then when we do that, I will turn over to the bell, and listen for bruits in the bilateral renal arteries, which will be just to each side of the umbilicus, and then the aorta, which will be just above the umbilicus. Again, we should not hear anything with that. He definitely has bowel sounds in all quadrants. So now, left renal artery, excuse me, right, left, and aorta. I hear no bruise or anything there. Okay, and then with palpation, what we're looking for here is any pain, that he might have. Okay, I'm holding percussion next. Going to do the same thing, percuss. It should be resonant over areas that are air-filled, bowel, stomach where he hasn't eaten, and then it will be duller over areas of organs. Definitely hadn't eaten. Okay, and then we'll go into palpation. Start off with light palpation, and then slowly get deeper. And again, we're going to ask the patient, to look at their face for any signs of tenderness, and ask them, let me know if you feel any tenderness. Okay. Start out just light. Okay, and then go a little deeper. Very good. And from that, we'll go to the liver. The liver, again, you're likely not going to palpate that, be able to feel that, unless there is something going on. It's an enlarged liver, or it's cirrhotic, whatever. Unless maybe a small child, or people that are really thin, you may. And again, the liver is on the right side. I've seen a lot of videos of people that can't feel the liver over on the left side. So make sure you're on the side that you need to be. And basically, you just sort of try to get your hands up and under the ribs a little bit, and sort of go a little deeper. And nothing. I mean, he works out a lot, so he's a real muscle tone. So it's really hard to palpate. So that's fine. Okay. Again, we're going to do that in the proper order. Okay. Lower extremities. Okay, first of all, just looking at the lower extremities, again, everything seems symmetrical. Do you mind taking your socks off? Okay, so just looking at, the lower extremity, everything is symmetrical. The hair growth is symmetrical. It goes all the way down. There's no areas of baldness or anything. So just... We're going to palpate pulses. We're going to do the popliteal, the dorsalis pedis, and the tibial, or posterior tibial. Popliteal. Sometimes popliteal can be a little bit hard, at least for me to find. Can be deeper, but I do feel his. Posterior tibial. Those are all good. Okay, so also I don't see, in palpating here, no areas of pain. I see no edema, anything like that. Okay, so range of motion. First of all, we're going to do bilateral hip. So if you can, just one leg at a time, just raise your leg up at a 90 degree. Okay, other one. Okay, and then bend your knees up towards your chest. Very good. Okay, and then point your knees, turn your knees in and then out. Okay, so good with that. So now with the feet and ankles, if you can, just pull your feet up to you, and then down, and then against resistance. And down. Okay, very good. All right. Okay, got all that. Okay, so now we're gonna do the patellar, Achilles, and Babinski. So if you will just have a seat, well, I'll tell you what, we can actually do the Babinski with him laying. And you can do that. It's okay if the heels are against, or are against something. They don't have to be. They could be out. You could even do this sitting. But, you know, what we're doing here is you're starting at the bottom on the lateral side, and then working your way all the way up. And an abnormal finding would be for the toes to fan out and come up. It's okay if they go down, but on an adult size, they should not fan out. That shows a neuro deficit. It can do that in children, but not in an adult size, which we're gonna have. Okay, this is gonna feel sort of strange. Okay, and his toes did sort of go down. Okay. There. Okay, very good. So what we shouldn't see again is an upward or fanning out. All right, so now if you'll just have a seat. Are you cold?
Yes.
Sorry. He got it cold, and it started out really warm. We're almost done. Okay, so for the Achilles, that's just going to be back on the Achilles tendon, back behind, above the heel. And again, you should see the leg sort of come up. Just going to do that on one side. Okay, and then the patellar, and this is the typical one that you've all. Okay, there we go. Very good. Okay, and then cerebellar function, just run your heel down your shin. Okay, and then other side. Very good. Okay, and now then we're going to do lower extremities with the patient standing. If you'll just hop up, and then if you'll walk like down that way on your heels and then back on your toes. Okay, sorry. Okay, and then the Romberg test, and with this, you're just going to have the person stand, close their eyes, and look at their posture. So just close your eyes and try to stand. Okay, a small amount of swaying should be fine, but it shouldn't be a tremendous amount. Okay, that's good. If you've got a really elderly patient that you assume may not be very stable, make sure you provide some support in case, or be ready to support in case they fall or whatever. Okay, hop on one leg, and then the other. Very good. Okay, and then if I can just have you bend forward, and just looking at his spine, there's no curvature. It's it goes straight down, and then can bend over and sort of touch your toes. You got it. There you go. And then bend backwards, and then side to side. Very good. And that's it. Okay. You need to get out here? Thank you very much. I appreciate that. Yeah, thank you for coming out of school.